Health Watch, carpal tunnel syndrome is a painful progressive condition caused by compression of a key nerve in your wrist, and it can cause numbness, weakness, and pain in the hand, the wrist, and it radiates up the arm. More than 3 million cases are diagnosed every year. Shelley Bota tells us about a new minimally invasive surgery that has people going back to work immediately.
Traditional carpal tunnel surgery involves up to 6 weeks of recovery and therapy. But a new non-invasive surgery called the Guo Technique is less painful and involves minimal recovery time. George Smith has no problems holding utensils or other objects with his hands.
I do a lot of writing. I can write well.
3.5 years ago, George had a problem gripping anything with his left hand due to pain from carpal tunnel syndrome.
I couldn't pick up a pen. I would drop it.
So he had traditional surgery.
And traditional way to do the carpal tunnel release, you cut the skin, cut the subcutaneous tissue, and eventually cut the ligament and close the wound.
That was pretty brutal. That was very hurtful.
George missed about a month of work.
Traditional carpal tunnel surgery usually takes 4 to 6 weeks to recover.
And it required George to do weeks of therapy at home.
So I just worked my hand, kept working it, kept getting it stronger.
Occupational therapist Mitch Voss at Aurora BayCare Orthopedic and Sports Medicine says traditional surgery requires therapy due to scar tissue.
So making sure that the scar tissue doesn't get thick through the palm and making sure that there's good mobility through that scar tissue.
When George was diagnosed with carpal tunnel in his right hand, he decided to go to Dr. Danzhu Guo at Aurora BayCare Medical Center. Instead of traditional surgery, Dr. Guo used the minimally invasive Guo thread carpal tunnel release.
Now we use a wire loop the ligament under the ultrasound guidance. This way, it's only 2 needle poke, and we can cut the ligament without cut skin.
Call my right hand my miracle hand. It was almost 100% pain-free.
The Guo technique leaves no scar tissue, so no occupational therapy.
You don't have to worry about that scar tissue potentially getting stuck and attaching to that nerve and restricting movement.
George just had to do a few hand flexing exercises.
I got the strength back almost immediately.
But the majority of people can go back to work within a day.
George was able to hold a pen soon after surgery.
The nurse made me write that day.
George's left hand still bothers him.
That's why I'm contemplating and considering redoing my left hand.
Dr. Guo and his 2 brothers invented the Guo technique, and his group is the only one using it in our area. To learn more, you can call Aurora BayCare or email healthwatch@aurorabaycare.com. And that's your Health Watch. I'm Shelley Bota, Local 5 News.